Causes of depression. There are many theories in circulation to explain the causes of depression, and perhaps the most common are the substances and chemical reactions that occur in the brain, but there are millions or billions of chemicals in the body that can be responsible for a person's mood and outlook on his life and related matters. There are many other factors that may be biological or external influences that may have a role in the possibility of people developing depression, and although there is still no specific and known main cause of injury, we mention in the following some of the factors that could be it has a role in the development of depression. Biological differences. It is believed that people with depression may have physical differences in the shape of the brain. Brain chemistry. There are chemicals called neurotransmitters, in English, neurotransmitters, in the brain, which studies have shown that their functions and impact play a major role in controlling people's mood, and thus the feeling of depression and how to treat it, and one of the neurotransmitters that play a role in this, serotonin, dopamine, and norepinephrine. Hormones, English, hormones. An imbalance of some hormones may have an effect in stimulating or causing depression. This imbalance may occur during pregnancy, or due to thyroid problems, or in the postpartum period, English, postpartum, or upon reaching menopause, English, menopause. Genetics. Depression is often more common in people who have other family members who suffer from it, and scientists are trying to uncover the genes that cause depression. Other life factors, such as exposure to trauma, abuse, loss of loved ones, exposure to financial problems, chronic diseases such as cancer, stroke, heart disease, or mental disorders such as stress, anxiety, eating disorders, in addition to the nature of the personality, for example, lack of self-confidence or weak personality. In fact, the types of depression differ between people with depression according to the different symptoms and signs that appear on the sufferer, in addition to the different causes, and here we mention some of the most important types of depression, previously. Partial depression, commonly known as dysthymia or, in English, persistent depressive disorder, a feeling of sadness or low mood for long periods of up to 2 years or more. Seasonal affective disorder, in English, seasonal affective disorder. Signs of depression appear on a person with this type of it during certain periods of the year, often in the winter period when exposure to light is low, and the injured can be treated by taking antidepressant medications or through light therapy, in English, light therapy, but it usually disappears when the spring or summer begins. Atypical depression, in English, atypical depression. It is a type of depression that differs from major depressive disorder in some symptoms such as, a feeling of heaviness in the extremities of his body, sleeping for longer periods than usual, and an increased sensitivity to criticism, and it should be noted that the sufferer usually what is felt is a noticeable and temporary improvement in mood when faced with a positive event. Bipolar disorder, English, bipolar disorder, a disorder during which the sufferer goes through periods of euphoria and high mood, and other periods in which symptoms of depression appear. Psychotic depression, English, psychotic depression. This type of depression is represented by the coincidence of symptoms of depression sometimes with symptoms of psychosis, such as hallucinations, delusions, and paranoia, or as it is known as paranoia. Postpartum depression. Postpartum depression is a woman's feeling of depression during the weeks or months following childbirth. Premenstrual syndrome, in English, premenstrual dysphoric disorder. Some females may feel depressed at the beginning of the menstrual period, and it may be accompanied by some other symptoms, mood swings, stress, and irritability. Situational depression, in English, situational depression, which is a feeling of depression as a result of exposure to difficult circumstances, like the death of a close person, problems at work, or the end of a relationship.